it's a very difficult thing to identify because they can't express themselves. So what happens with him is that he's very vocal in saying he's not well, okay, but he's not vocal in describing what is happening.
Sometimes in the initial times of his dementia, he was unable to tell his pains or his headache or stomach ache, any issues. So come towards me and take my hand and put it on stomach or tummy or on his forehead. That indicates that he is not well.
So हमको पता चलता है तो बॉडी लैंग्वेज से, क्योंकि मेरी वाइफ कुछ बोल नहीं पाती थी, लेकिन हमको पता चलता है ये 3-4 दिन से कोई थोड़ा कुछ कम लग रही है, कुछ उतना जोश नहीं है आंखों में, बातें कम कर रही है, जो भी बातें ये जो मैं कह रहा था ना ऐसी आती थी, फिर भी वो कम हो रही है. सो थोड़ा ज़्यादा यहाँ बैठ के सो रही है. सो उससे पता चल जाता है कि कुछ ठीक नहीं है. हर वक्त यूरिन और स्टूल देखना पड़ता है जब भी पास होता है, क्योंकि यूरिन का अगर कोई स्मेल हो या कलर कोई डिफरेंट हो, को इमीडिएटली पता चलना चाहिए. सिमिलरली जो है स्टूल का भी नंबर 2 का भी देखना पड़ता है.
They don't say that I have a pain. Hardly they actually realize it. But again, with observation, we can make it. So if a person with a knee pain is walking, is one thing is going to impact it, and there's swollen and things like that. But then they just feel that something like some gestures they do. This kind of these things, some winking in the face, and then these things is a sign that is saying that there is a pain.
People with dementia experience pain just like you and I, but they might have difficulty expressing it in words. While it differs for each person, look for signs such as facial grimacing, guarding a particular body part or reluctance to move it, moaning, or changes in the way they walk or they generally move about, increased heart rate, blood pressure or sweating, reduced appetite, or disturbances in their sleep patterns, or they might become lethargic. Changes in behavior such as increased or reduced tone of their voice, restlessness, anger, irritability, crying, or social withdrawal. So meet your doctor and find out if any of these changes could be the cause of pain.
The caregiver need to be very sensitive to the potential sources of pain when they are observing that there is a change in the person's behavior. So when a person is very aggressive, very often it could be because they have an underlying tooth pain or underlying urinary infection. These are all the very common things that, or prostrate pain for men.
A pain management strategy where it includes the kind of preventions of bed sores and or early identification of any reasons for pain. For example, there is a limitation in movement, and that can be an indication that there is a problem in that area.
Always reassure that and pay attention to whatever the patient is expressing, even if they have done this earlier. Yes, this is what happened, this is how you hurt your hand, and we tended to this particular wound in this way. Give them the context again and help them, reassure them, is one way in which physical pain can be dealt with by caregivers.
If you are the person giving bath, you are giving care to the person, completely dressing up. When they want to lift the hand or lift the leg, they cannot lift. So then you can slowly communicate them whether the pain is here. You can locate and ask them whether the pain is here. So they may communicate.
Minimal physical exercises is a must. You just put them on a bed, they'll become bedridden. So physiotherapy, flexion, extension, rotation, sitting down, getting up, all these things will come. Both the upper limbs and lower limbs have to be kept active.
ಅಂಥ ಟೈಮಲ್ಲಿ ನಾವು ಎಷ್ಟು ಮಾಡೋಕ್ಕಾಗುತ್ತೆ ಅಷ್ಟು ಮಾಡ್ಬೋದು. ನಾವು ಅವ್ರನ್ನ ಅದೇ ಕೈ ಕಾಲು ಒತ್ತೋದಾಗಲಿ ಅಂಥ ಪೇಷಂಟ್ಸ್ ನಾವು ಸ್ವಲ್ಪ ನೋಡ್ಕೊಬೇಕಾಗತ್ತೆ. ಅಂಥ ಹೊಟ್ಟೆನ ಸವರೋದ್ರಲ್ಲಿ ಅವ್ರಿಗೆ ಸ್ವಲ್ಪ ರಿಲೀಫ್ ಆಗುತ್ತೆ. ಏನೋ ಒಂದು ನೋವ್ತಾ ಇರೋವಾಗ ಎಲ್ಲೋ ಒಂದು ಬೇರೆ ಕಡೆ ನೋವ್ತಾ ಇರ್ಬೋದು, ಬಟ್ ನಾವು ಎಲ್ಲೋ ಒಂದು ಪ್ರೀತಿ ವಿಶ್ವಾಸದಿಂದ ಮಾಡ್ತಾ ಇರೋವಾಗ ಅವ್ರಿಗೆ ಅದೆಲ್ಲೋ ಟಚ್ ಆಗುತ್ತೆ.
Addressing the pain issue not just by analgesics but by supportive measures is also important. especially in elderly patients or patients with dementia. Sometimes pain would be kind of expression for underlying need. It could not just be physical, it could be something else.
Effective pain management is very important for the patient's quality of life. You can possibly prevent pain from happening by dealing with things like good hygiene and having the person active so that you don't have muscular spasms. Managing the pain involves having the person to go to a doctor so that the doctor can find out what the pain is due to. And simple pain management strategies at home are using some balm to give a massage, simple painkillers, or soothing the patient by stroking or talking to the person calmly. These are strategies that can be used to relieve pain very easily. Relieving pain is very important for the comfort of the patient so that he or she does not have various behavioral symptoms.